Miss Granula. How are you doing?
I'm okay. I'm a little nervous. My arm hurts, and I'm just bathing it like it's made of glass.
Hopefully we can get that fixed up for you. My name is Nurse Abraze. I came here with 2 wound care specialists so we can teach you how to take care of your wound. Before we begin, can I get your last name and date of birth?
It's Eleanor Granula, 5360.
Awesome. Thank you.
Thank you.
Miss Granula, here's the first wound care specialist. This is Miss Scarn.
Oh, hi.
Hello there, Miss Granula. I heard that you have an injury on your hand there.
Yeah, I tripped over my granddaughter and got a little skin tear.
Oh, darn it. Well, let's take a look at this quick here before we,
It's gonna hurt?
it might hurt just a little bit, but it really shouldn't. I'm gonna be really gentle, okay?
Okay.
All right. So I'm just gonna have you move your arm here a little. Perfect.
Am I gonna have to do this at home?
You are. That's why we're gonna teach you how to properly take care of your wound.
Oh, sweet merciful heavens, thank you.
You're so welcome.
You sure you can't send that strapping young nurse home with me?
I know, right? Okay.
Oh.
Look at that. Well, it looks like it's healing very nice. So let's go get over to the sink and we're going to show you how to clean your wound, okay?
Miss Granula, this is our second wound care specialist, Miss Fistella.
Oh, hi.
Hi, Mrs. Granula. I'm Miss Fistella. How are you?
I'm okay. I've been better. Are you here to teach me how to clean this thing?
Yeah, I'm here to help you with your wound care so you can do it efficiently at home.
Oh, okay.
So we're gonna wash our hands for 20 seconds before we do our wound change,
Okay.
wound dressing change. So let's do it.
Okay.
Okay, Miss Granula. So we're going to use warm water with very mild soap, and you're going to just very gently rub your wound site. You don't want to be too aggressive that those stitches get popped open, but you want to make sure it's nice and clean while you're running it under the water.
Oh, is it gonna hurt?
It might.
Whew.
Is the water too hot?
No, it's just the way I like it.
Okay. Very good. Make sure you're not too aggressive with it. Perfect.
Can I rinse it off now?
Rinse it off. And when we're done rinsing, we're gonna pat dry it off.
Okay. Ooh. Still some soap on there. It's really hanging in there.
Perfect. And then pat dry. Very good. Let's get you back into bed and we're gonna teach you how to change the dressings.
Okay.
All right, we are gonna teach you how to change and put some gauze onto your wound. So why don't you put your hand right out here for me?
Okay.
Perfect. So this is called an adhesive island dressing. This is a really great option for you because it has a little bit of adhesive on the sides and nice padding. And what you're gonna do, because it's sticky, is peel it and place it right on your wound. And this is perfect because it has at least a 1/2 inch margin around all corners of the wound site.
Oh, okay. That would be nice. It's not gonna stick to my wound.
Exactly. Should we talk about you going to the pharmacy and what you shouldn't buy?
Yes, because I know there's a lot of options. I've seen them there before, and I definitely don't want to buy the wrong thing.
Exactly. There are tons of options. So this is a gauze. Nurse Abraze is going to tell us why we wouldn't want to use a gauze pad.
Miss, we wouldn't want to use gauze on your wound because upon dressing changes, it could pull the wound apart and open it back up.
Oh, that sounds awful.
No, we don't want that.
This is called a combine pad. You can feel how thick it is.
Oh, I like that.
That's way too absorbent for your wound. That's something that we also wouldn't want to use.
Okay, so no gauze, no combine pads.
Nope. And then this is a foam dressing, and this could put too much pressure on your wound, so you wouldn't want to use this either. Okay, Miss Granula, now Nurse Abrase is going to explain to us why having the proper dressing is important.
Okay.
The reason that we want to put this specific bandage on is because we don't want to cause infection like other bandages that would keep the wound super moist. That could build up bacteria and ultimately cause an infection in your arm, which we really don't
Oh,
want.
I do not want that. Can I just let it air dry?
No, we want to pat it dry while you're cleaning it and the dressing changes, and then apply the island wound. Reasons you would want to contact your healthcare team is for signs of infection. Signs of infection include heat, swelling, the presence of pus, discoloration, and terrible odor.
Oh. So if it gets funky and starts burning, I should call you?
Yes, ma'am.
All right, here you are, Miss Granula. It is a list of instructions for taking care of your wound at home. Just gonna go over a quick couple of them with you. So just remember to wash your hands before you clean your wound for at least 20 seconds. Use warm water and mild soap to clean the area. Pat dry it. Look for signs of infection. Then cover it with a large adhesive Band-Aid. And let us know if you have any questions or if you see any signs of infection.
Okay. And how often do I need to change my dressing?
At least every 3 days or as needed. So if you take a shower and it's completely soaked, then it's probably a good time for you to change it.
Okay, perfect. Oh, well, thank you guys so much for your help. I might be fragile, but I'm not helpless.
Well, you're doing an amazing job and we believe in you because wound care is very important.
Thank you.
Before we let you go, we want to do a quick overview of the important highlights to discuss with your patient when educating them on proper wound care.
First, the patient should understand why hygiene is important before cleaning the site. We're looking at things with healing interruption and bringing harmful microorganisms that can result in infection.
The patient needs to be cleaning the site properly in between dressing changes. You want to, when they are cleaning it, you want to make sure that they're using a mild soap, warm water. Peroxide is contraindicated because it can result in tissue death and disturb wound healing. So just making sure that you're using the right materials to clean the wound is very important.
And upon drying, you want to make the patient understand that while they don't want it to be overly moist, we also don't want them to rub it dry. Just risk tearing the wound open and causing further damage.
And then when they are taking a trip to the pharmacy or we're sending them home with materials, we want to ensure that they have proper dressing for the particular wound. So in the video, we discussed how using incorrect dressing can harm the patient's healing process. So just things like using a gauze incorrectly can cause it to just get pulled open or just things like that.
Two things you want to focus on during wound care education is avoiding wound disruption, which can lead to impaired healing, and the risk and signs of infection. It's kind of what you want to highlight.
And then some signs to look out for and to educate the patient on when they are looking at their wound is if it's red, if it's swelling, drainage, odor, increased pain, or even if it's not healing.
And just remind the patient to seek medical attention or call a provider to discuss whether or not they should be seen if they're experiencing any of these symptoms.
And again, just having an open and honest conversation about how it might hurt when they are doing a dressing change within reason. It's like if you fall on a trail and you scrape your knee and you have to pull some rocks out. It's going to hurt, but it needs to get done and it needs to get clean. So even though it hurts, it doesn't mean that we should avoid taking care of our wound.
Yep, so make sure they know it's gonna hurt at least a little bit.
Okay, happy wound care!
Yay!